Would you like to help your patients without having to drill on their teeth? My name is Paul, Dr. Nacho Goodman. I've been a dentist for 19 years, and that's a pretty cool thing to do. I'm here with key resource and sponsor, founder of Infinite Dental Technologies, Brandon Bomar. He's going to share with us how RayScan, a CBCT that you can add to your office, is helping dentists help patients without having to drill on their teeth. Brandon, thanks for being here. Share that story about when you installed a CBCT and the first patient that took a scan on, what happened?
Absolutely. Thank you again for having me. I appreciate it. We were just talking, and one of my doctors in New Mexico had purchased a RayScan Alpha Plus, which had a 16:10 field of view. First patient was wife's best friend, who happened to be a police officer in that area. Came in just to scan for an implant case they were doing. We ended up showing off the airway feature. We measured the airway, took about 10 seconds after that scan was finished, so no need to do anything special beyond that. And just the emotion you could see from both her and from our dentist. She had a very constricted airway, and you hear stories about issues with the throat. There was some genetic issues with her dad, not waking up refreshed, issues with anxiety, obesity, things like that. And it was really a special moment to be able to see is, you buy it for one thing, hey, I want to do implant cases. And then here's patient number one that's getting so much more out of that just by taking
it's such cool to share that. What we found as dentists, we often can solve problems quickly. We say, oh, there's decay, cavity, missing tooth, implant. But with things like sleep apnea, people have chronic symptoms and they don't know where they come from. Sometimes they go to doctor and doctor. We have a sleep apnea focused GP. So you are the president of Infinite Dental Technologies. Tell us, you sell CBCTs. Think of this like a store. How many do you guys sell? What are dentists looking to invest in? You know my dentist people, and you work with them. They like details, right? They like details of the detail. They would like if you could take a CBCT of the CBCT. They would like that. So give them some details. Somebody's watching thinking, I'd like to add one in my practice, but I'm a little overwhelmed. What are some of the choices you guys have?
Sure. So 6 different RayScan options that we have. They start from the low 50s up through the mid 120s. So we do start with conversation. We want to make sure that we're addressing your needs. Where are you looking to take your practice in the next 5 to 10 years? We want to make sure that we don't sell you short on what the needs are. We would just have a conversation. And normally it starts out with, once we figure out what your needs are, we do a 30-minute remote demo. So I can do that from any of my devices. My team can do that remotely. And we just kind of walk through. We show you a little bit about kind of who Ray is. Not many people know the story. They're becoming more of a household name here in the United States, but not many people know that, they started off with Samsung and had a huge kind of history with them. And now they're completely separate from them as of about 6 years ago. But overall value, I've done a lot of studies. I've dealt with other cone beam companies in the past, and best overall value, hands down, RayScan for the US.
Awesome. So tell me about, what is the most common one people order? And then tell us what the cost is.
Sure.
So big fan of prices right back in the day. My dental people, they like cost. So let's just give it to them.
Let's
do the most popular option. What's the cost? And then what's the special Nacho discount as you guys being awesome sponsors?
You got it. So the most common unit ordered is the Alpha Plus 160. That is a unit that has a max field of view of 16:10, but it can go all the way down to 4:3 in a 70 voxel size, which is currently one of the smallest voxel sizes you can get in a cone beam. So very, very.
So you could use that for implant dentistry, sleep apnea.
100%.
Gotcha.
Yep, 100%. So extractions, implants, endo, perfect. That smaller field of view is perfect for that. That has an MSRP of $115,000. Other distributors, I've heard it being sold anywhere between 75 and 80 range. The discounted rate for you guys would be $64,000.
Look at that. Lots of savings just for knowing me. So like my grandmother said, I am special. I've got you guys a deal. That's why we have awesome sponsors supporting our group. Now, if someone's watching this point and say, hey, Brandon, I'm ready to do the demo. I always JDD, just do the demo. How can they reach out to your team? Our team is going to share how to reach out to you in the comments of this, but also if someone's just watching, how can they reach out to you and your team directly?
Sure. A couple different ways. You can go onto our website, which is Infinite Dental Tech, TECH. Under request a demo, please just fill out name, email, phone number, and put Nachos somewhere in there, so we know where you guys came from. You also can reach out to our business development specialist. His name is Christian Petrino. His email is chris@infinitedentaltech.com. You can also reach out to me at brandon@infinitedentaltech.com. And I know we'll probably list some contact phone numbers in the comments.
For sure. And I really, just in a broad picture way, we want to help dentists go from feeling like this. I feel like this as a practice owner. Sometimes it's not easy to be a dentist, to feeling like this. Adding a CBCT has been a great thing for my practice. I wish we had done it sooner. Now there's so many awesome options that you have here from Infinite Dental Technologies. I appreciate you being a Nacho friend, Brandon. Now we're going to get you one of the best cheesesteaks in Philadelphia.
I'm looking forward to it. Thank you so much.
Awesome, guys.